Dr. Aronovitz, nice to meet you.
Nice to meet you.
Thanks for coming in today. Tell me what's bothering you about your hair loss.
Well, I have this little patch, this little bald patch back here that seems to be growing.
Okay.
And I would like to just have you take a look at that and see if there's anything I can do to treat it.
So the frontal part's not bothering you as much as the crown part of your head.
That's correct.
Okay.
Yes.
Up to date, have you done anything at all to try to help with this? Any of the medications available or anything like that at this point?
Yes, I've started using Rogaine and I've been putting that on the back of my hair.
Great. That's a good start. How long have you been doing that for?
I am on 2.5 months right now.
Awesome. Very good. All right. No problems with it? No itching, flaking, redness, nothing like that to your scalp?
None at all.
Beautiful. And the finasteride or Propecia, you've not attempted to try anything with that yet?
No, I have not.
Okay, very good. So my goal is to kind of look through your head first, see what things look like, and I'll do that in a moment, and then we'll go through the whole details of the surgery, tell you if you're a good candidate and so forth. The start of the Rogaine's been really good, but you have these very short, finer hairs throughout this area that are called vellus hairs, and these hairs are showing me that they're kind of going out of cycle and you're about to lose them, so the Rogaine will capture those and bring them back. So there's a good chance a lot of this will fill in, but there's also spacing where you're seeing some baldness down to the skin level, and most likely those follicles are gone and you'd have to replace it. But back here, where the hair is very thick and where we get the hair from the donor area, you have plenty of good hair back here to take care of that for you if you want.